Hi everyone, welcome to today's video. I'm Mary Felling, physical therapist. Today I'm going to be showing you 3 muscle strengthening techniques and 2 myofascial release techniques to help with sacral issues and pelvic floor health. So if you're someone who has tailbone pain when you're sitting, if you have bowel or bladder issues, if you have pelvic floor pain or dysfunction, or maybe you just want a program to maintain and get a good healthy pelvic floor, this video is for you. All you're going to need is a 4-inch ball. I've got a link in that description below to an option for you. And then also you just need a pillow. All right, so let's start on our first exercise. You're going to be on your back. You can use a pillow under your head. You don't have to. I prefer it. It's comfortable. We're working on the abs. So we're going to work on the real low abs. I'm going to show you this technique, and we'll talk a little bit about why we're doing this. And all you're doing is lifting your fanny up off the floor and back down. You ready? Let's count them out. So hold, 1, 2, and relax down. Number 2, relax down. Here's number 3, relax down. We're working on the abs because through our lifetime, our lower abdominals tend to become weakened just because of the lifestyle we live here in the United States. But the lower abs are very important for pelvic floor strength. And so what we want to do is start getting that strength returned to have a healthy pelvic floor. All right, this is number 8. Here comes number 9. We're just holding it for 2 seconds. Last one of the first set. Lower your legs. And we're going to take 2 deep breaths. 2 deep breaths usually equals about 5 seconds. So you can time yourself if you want 5 seconds, or just do 2 deep breaths. Either one between. All right, second set. Here we go. 2. So it's just a very short hold. You can use your hand right above your pubic symphysis, the pubic bone, and you want to feel that area tense under your fingers. That's how you know you're using the right muscles. You're naturally going to be using some of the other muscles too. All right, so here we go. We're on number 8. Here's number 9. Last one of the second set here. Good. Those 2 deep breaths for 5 seconds. All right, last set of 10. Here we go. Lift up. Relax. They're all 2-second holds. If you're getting fatigued and you really don't have the stamina, that's fine. You can stop here and then just every other day add on another repetition till you can do 3 sets of 10. That's number 5. Here we go. 5 more. That's number 6 and 7, 8. 2 more. Last one. And bring your legs down. Very good. I'm going to have you turn over onto your tummy. We're going to exercise the glute muscles. Glutes also very important in pelvic floor health. That's why we're working them. And in our life here in the Western world, we tend to become very weak in our glutes for a lot of reasons, mostly just because of our positions and poor postures through life. So we're going to strengthen them back up, help our pelvic floor. Knee is bent to 90 degrees. So I'm not out here, and I don't have my heel back near my rear end. It's about halfway. Look at my foot. My sole of my foot is going to push up to the ceiling. All right, that's the position. You ready? Here we go. Hold, 2, 3, and come on down. And 2, 2, 3, come on down. 3, 2, 3, come on down. For most of you, it's probably easier to be like that. I have my hand out of the way just for these video purposes, so I can see your smiling faces because you love this. That's number 6 there. Really good, everybody. You're doing great. Here comes 7. If you haven't done glute exercise in a while, you'll feel this. And here's number 10. Hold just an extra second. Come on down. We're going to take those 2 deep breaths for that 5-second break before we go into our second set. Ready? Knee is bent to 90 degrees and lift. Squeeze the glute. Squeeze your cheek. For each repetition. Here's number 3. Squeeze that glute. Squeeze hard. Do your best to really tighten. Make sure you're not bringing your foot close to your hips like that. Keep it out here. Here's number 8. It's number 9. And last one of this second set. Very good. Let your leg down. Do your 2 deep breaths. Got to let the muscle recover. There's our 2 deep breaths. And last set of 10. Ready? Squeeze that right cheek, or left cheek. I'm on my right. So squeeze the cheek of the leg you're lifting really hard. That's where the power is coming to lift your leg up off of the mat or the floor, or your bed, wherever you're lying down. Here's number 7. Number 8. Number 9. And on this last one, just hold a few extra seconds. Hold, squeeze. Come on down. We're going to switch legs. We're going to come over to the other side. Same things apply. And when you're ready, here we go. Lift and lower. Lift for number 2 and lower. 3. You're doing great. Number 4. Here's 5. Here's number 7. Just 3 more on this first set of 10. 9 and 10. Take that 2 deep breaths, that 5-second break. And we're back at it. Set number 2. 2. So our glutes tend to become very weak because we are a society that does a lot of sitting. We sit at our desk, we sit in front of our computers. The glutes get a lot of weakening, and so we've got to strengthen them back up because they are part and parcel of good pelvic floor strength. That was number 8. Here's number 9. And here you are on number 10. See how easy this is? We only have one more set. And here we go. Lift. 3, 4. You can do it. You can do it. Look at that. Just 5 left. 7. Here's 8 and 9. And on number 10, just hold a little few extra seconds. Squeeze, 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 and relax. Very nice. All right, we're getting into the third and final strengthening technique. This is for the inner thighs. It also helps some of the hip rotators. So I'm taking my heels of my feet and I'm pressing them together, and my knees are wider than my hips. So I'm not here doing this. My knees are out. All right, and for this exercise, you're going to be pressing and squeezing the heels of your feet together. You want to feel it from your center. Here we go. So compress, 2, 3, and relax. And compress those heels and relax. 3rd, feel it coming from the inside of your thighs. Here's number 4, 2, 3, and relax. And feel it coming from the pelvic floor. 2, 3, and relax. All right, here's number 6. If you're not sure if it's coming from the pelvic floor, look on my channel, you'll see one for Kegels. The Kegel exercise will help you find all your pelvic floor muscles. There's number 9. And final one, hold, squeeze the inside of your thighs, squeeze your pelvic floor, and relax. We're going to do 2 more sets of 10. Did your 2 deep breaths? Great. We're ready to go. Here we go. Squeeze and compress those heels. And relax. And squeeze. And relax. And squeeze. And relax. We're getting all the support muscles for the pelvic floor this way. They just become weaker through. Here's number 4. I'm sorry, number 5. And relax. Number 6. You guys are doing great. And relax. Number 7. And relax. Do these for the next 14 days, by the way, in a row. That was 8. Here's number 9. Relax. And last one, hold the tension. Squeeze. Compress those heels as hard as you can. Feel it down on your pelvic floor. And let go. Very nice. Okay, so we're going to come up into sitting. And I'm going to put my hair back the way it used to be. And you're going to get that ball, that 4-inch ball. You can do this sitting on a chair. I'm going to do it right here on the floor. You can do it with yourself leaning against a wall if you don't have good support, if you don't feel like you can sit well. This is going to go between your sit bones. We're sitting on the ball, so mine's pretty squishy. I'm going to put it between the two sit bones. And it's forward, the ball should be forward of your tailbone. If it's back towards your tailbone and you're sitting on the tailbone, you'll probably feel it's too much. Just come forward a little bit and you'll feel the pressure up against your sit bones. That's where you want it. You'll know if you're too far back because you hit the tailbone, and you'll know if you're too far forward, you men especially. But women, you'd be sitting on your vulva if you were too far forward. If you are somebody who doesn't have a lot of flexibility in the hips and you can't get your knees down further than that, take one pillow or two pillows, whatever you need to support those knees. All right, so we're going to do 5 minutes in this position. We've got the clock going. So what you're doing now is called a myofascial release technique. These are John Barnes. I was trained in the John Barnes myofascial release technique. I've been doing this for 25 years with my patients. And what I found is when I started helping and working and concentrating on the fascia, besides the muscles and the joints and everything else, I find that I got permanency to the positive changes with my patients and with myself. I do these exercises also. So what's happening right now is we're creating space down in the pelvic floor. And a lot of times with pelvic floor patients they had so many restrictions, myofascial restrictions, areas where the muscle and the connective tissue were so tight. And so they'd lose some of their hip mobility. They would lose some of their this natural space in their hips. And this is such a great technique. It opens it up, it relieves pressure down on the tailbone and the sacrum. It allows the sacrum and the tailbone to move back into their place. This is just great for getting the pelvic floor back in its natural alignment, in its natural place it's supposed to be. So if you've ever had a fractured tailbone or fractured sacrum, this will really help from all of the trauma and the tissue and the tightening that goes on from a fracture over the years in the pelvic floor, the sacrum and the tailbone. It's really good for it. And this is also good for helping the hips get balanced again. So why 5 minutes? Why not just 20 seconds or 30 seconds like a muscle stretch? Well, what we now know about fascia is that it takes a minimum of 5 minutes of uninterrupted mechanical energy. In this case, we're using compression. And that mechanical energy, after it moves through, after 5 minutes of putting the mechanical energy, it elicits this electrical flow. And it's also called the piezoelectric effect. So this piezoelectric effect moves, this bioelectric flow moves through the fascia, and when it comes to these areas where there has been damage or overuse, repetitive use, where the fascia is bound down and tightened and compressing sensitive areas, it helps it to rehydrate, relax, open, and lengthen. And so now you get mobility back, and there's less pain because you're not creating, because you've lost and eliminated the tension through the muscles, the bladder, the bowel, all the structures in the pelvic floor that were painful because of that compressive force. Myofascial restrictions can place up to 2,000 pounds of force per square inch. Well, this is a very pain-sensitive area, our pelvic floor. So if you've got restrictions in there and you're tense and you're tight, and every time you sit down, your tailbone hurts or your perineal area hurts, where your perineum, try to say that. Your perineum is bothering you. This is a wonderful technique. For some of you, even a squishy ball might be too much, so I would suggest just start with a washcloth, just loosely knot it and start with that. That's enough compression to get that myofascial release, get that electrical flow going for you. So this is just so wonderful for everything pelvic floor, sacrum and coccyx and pelvis. Wonderful. It's ease. So what you're feeling for is some softening. You might feel like, oh my gosh, I feel something tugging up over in my hip, or you might feel it going down the leg. That's fine. That's your body's way of saying you have some restrictions and pulling down in the perineum, in your pelvic floor, that's created tension through the fascia, through the rest of your body somewhere, maybe to your hip or so. That's fine. As that moves away, you just got to release. You got a myofascial release in that area. All right, we're in the last minute here. You're opening, you're getting that space back that the pelvic floor loses over the years, especially great for women who've delivered children vaginally and have had some back pain, hip pain, coccyx or tailbone pain. This is great. It'll help you feel so much better. All of these techniques, by the way, you want to do for the next 14 days to help start opening and releasing the fascial restrictions, gaining your strength back. And then after that, just do it 2 or 3 times a week to maintain and keep it going. All right, 4 seconds left here. And I invite you to continue. You can do another 1 or 2 minutes if you want. You'll just get more releases. But if you're ready to go on, we're going to do one last myofascial release technique. So you're going to be back on your back. And all you yogis are going to recognize this. I think it's called the happy baby. And so I've got my hands inside my insteps. If you have very tight hips and you can't do this, we'll talk about a modification in a minute. So let's get that timer started. And it's probably obvious to you how this is opening the pelvic floor. It's getting a nice release. You'll feel this through the adductors. Those are the muscles and tendons on the inside of the thighs. You'll feel it up in your groin. Perfect. All right, so I said if some of you are too tight in the hips, I'm going to show you a modification. Now the rest of you stay in this position. But what you can do is get in front of a wall. So if I have a wall right in front of me, I can just rest my feet on it, and that'll hold my legs up for me. You can get as far away from the wall as you need to give yourself comfort. And just every 4 or 5 days, see if you can get a little closer to the wall and bring those legs up until you can hold the insteps yourself. Some people also get really, after a few minutes, might feel tender or sore when you're first starting out in the groin. Get a roll towel and just put the roll towel in each side of your groin. That'll help stop that compressive feel so you can be effective, really, because you do want to do the whole 5 minutes. Get that electrical flow going. This is so wonderful for helping to open the pelvic floor, get the elasticity of the pelvic floor back. This is good for helping to get the fascia through the bladder and the bowel release. So the bladder is a voluntary muscle. That means because we can contract it and hold back the flow of urine, or open, relax it and let the flow of urine go. But what will happen for some of us, especially if there's a lot of tension in the lower abdominal area, the fascia will tighten up due to stress. Yes, just being a human being around on this planet. And as the fascia tightens through the bladder in particular, it tightens like a net. And so what will happen as the bladder starts to fill with urine, it can only go so far, and so there's an immediate abrupt stopping. So all of a sudden the person feels that urgency, oh, I have to go now. And then there's frequency because the bladder can't expand to its full volume anymore because that fascia through the bladder wall is so tight. So opening up the fascia through the pelvic floor, which will help release the fascia through the lower organs, your bladder, your bowel. So function returns. And if you are having bowel bladder issues, I recommend those Kegel exercises I have on my channel too. Those will really help you with control. So as you're here, you may feel like your knees are coming out a little further, or they may be dropping down to the floor more. Yeah, you're just getting some opening. The muscles, the tendons are lengthening and opening. And that's the beauty about fascia work. When you do fascial releases, you are affecting the fascia and the muscles and tendons. in traditional therapies, when you're doing stretches for the muscles and tendons, it does not affect the fascia. And that's what I found when I started working the fascia into my patients' programs. They started getting permanency to their changes. They weren't coming back 6 months later saying they hurt again, that their thighs or their groin or whatever I was working on the pelvic floor was sore. They got permanency, and they knew how to take care of themselves. I showed them whole programs. It was wonderful. And it's important that everyone could know they're in control of their pain. They're in control of their bodies. You don't have to run back to the doctor or the physical therapist every time symptoms come back. Just address the fascia, and you'll see you get permanency. All right, we're in the end of our last minute of our 5 minutes. You're welcome to stay here for 8, 9 minutes. You'll just get more and more releases. Continue doing this for the next 14 days, and then drop it down to maybe once or twice a week to maintain it. It's kind of like going to the gym. You know, we go to the gym to work out so we can get in shape. But then once we're in shape, we don't stop going to the gym. We continue going to maintain that muscle tone and flexibility that we got from going to the gym in the first place. All right, last 10 seconds. You're just breathing, and as things release, just follow it. You might feel one leg going this way, one leg going that way. Just keep that pressure. All right, so there's our 5 minutes. You're welcome to continue going. And if you're done, thank you for following me. Thank you for showing up for yourselves and taking care of yourselves. I'll see you in our next video.